Healthcare is one of the toughest sectors to be providing lighting for because there are so many different pressures on you and so much at stake. At the moment, a lot of the projects in hospitals and care homes and so on are being driven by a desire to save energy, both in the public sector and the private sector. And of course, everybody wants that for the lowest possible upfront cost. But at the same time, the quality of light and the effect that light has on people couldn't really be more important than it is at a hospital bed or a care home or in an operating theatre. New technology holds a lot of promise. The problem is healthcare organisations aren't usually keen on taking risks, and some of them just don't have the resources to really get their teeth into a complicated lighting specification. So it's not easy. Those are just a few of the issues that we'll be talking about today. The idea is that it's an open discussion.
How do you balance the quality and the cost? Quality has always got to come top of your requirements and where you need to go and what you want to deliver. But cost is always going to be driving the key driver with any client who is cost focused.
The end user, to me, is the most important person in it, not the person that's actually giving me the money. Although it does have to be weighed up against it. I'd so much rather come out with a solution rather than something that's going to save me money.
As an engineer, quality is preferable, but unfortunately we have to be dealt with by the cost side of it. So it would tend to normally be the lower end prices would be driving us, but we'll try and get the best we can for the value for money, if that makes sense.
We like to be involved in the healthcare process right at the very beginning of the concept stage, and then at that stage we're needing to look at how we can monitor the desires and the objectives of the trusts themselves.
We tend to try and get involved with the trust at an early stage to try and influence strategies for lighting and other energy efficient concepts.
Project design and procurement sits generally within the mechanical and electrical engineers and how they lead a project, and the specialist lighting tends to be brought in to support their requirements and support their needs and provide additional support in providing something different.
It lies with the engineering department. There's very little outside influence on what we actually decide to use. We have been driven a little bit more just lately by a global procurement that's been going on. But again, this was based on things put forward by the engineering team that we wanted to achieve, as opposed to how much money can we save on this.
Depending on the procurement route that the actual projects go down, depends on our access to the trust, but what we do try is get embedded within the estates team so we can listen to their good and bad points from how the hospitals run from an estates point of view, and try and bring our knowledge and professional side of the sector into their hospitals.
The earlier we can be there, always the better. If we're starting to talk about delivery of better environments and influencing the architectural form and position on site, we'd always like to be there at day one to talk about daylight provision, access of natural light.
If you go into any healthcare building now, if you can just get the feel of daylight, even if it's secondary light coming through into a space, it just enhances it an enormous amount. So, you can't have daylight 24 hours of the day. You've got to contrast that with the artificial lighting, and it's getting that balance, which is very important.
We would like to make more use of daylight. Unfortunately, we've got a site that is very, very old, and what tends to happen as new builds are put in, they tend to get put into older areas and usually sort of squeezed into a gap. So what tends to happen is often daylight, that would be nice to have, it often doesn't get there, or it's not adequate. So we do end up relying a lot on artificial lighting.
We actually have been trying to demonstrate the good use of daylight in facilities is really, really good for the patient and for the well-being of them, because we all like to be out in a nice sunny day.
If we can come up with something that we can have peer reviewed and say, we have got this in our homes, nobody else gives this offering, not only in the UK, not even in Europe, but anywhere in the world, nobody actually offers this, then whatever money we spend on doing that review and doing that research, it will come back to us tenfold anyway. So, I'd certainly say that as regards me asking for money for research in that sense, there's no real problem with it, because obviously to us it's an investment.
I know there is some research goes on, tends to be manufacturer-led, but I think it's poor at the moment. I think a lot of it is in healthcare, everything is aimed around a specification, if that makes sense. It's around achieving a light level rather than a quality of light, if that makes sense. So I think it would be important for someone really to do this research.
I think it's an important part of what we're looking. So well-being in how you understand, or how. I think the issue is how do we define productivity, and how do you define staff well-being, and therefore information on how to ensure that we're delivering it and providing some sort of mechanism to raise that awareness and that agenda within the procurement process, within the decision-making process within a trust, to make sure that's an important consideration when balancing where the focus should be on priorities within a building.
Need a lot of room.